Hi there and welcome to You Own Your Health YouTube channel. Today, we're going to talk about everything you need to know about cardiac amyloidosis. So, let's dive right in. What is cardiac amyloidosis? Cardiac amyloidosis is a condition in which abnormal proteins called amyloid build up in the heart tissue, making it difficult for the heart to function properly. The accumulation of these proteins can cause the heart walls to thicken and become stiff, leading to symptoms such as shortness of breath, fatigue, irregular heartbeat, and swelling in the legs and feet. Cardiac amyloidosis can be caused by several different types of amyloid proteins and can be difficult to diagnose due to its vague symptoms. Unfortunately, there is currently no known cure for cardiac amyloidosis. However, there are treatments available that can help manage the symptoms and slow the progression of the disease. Treatment options include medications to manage symptoms such as diuretics, beta blockers, and ACE inhibitors, stem cell transplants, and chemotherapy. The specific treatment plan will depend on the underlying cause of the condition and the severity of the symptoms. It is important to work closely with a healthcare provider to determine the best course of treatment for each individual case. Please like and subscribe to our channel and click bell icon to get more health updates. What are the different types of amyloidosis? There are several different types of amyloidosis, which are classified based on the type of protein that accumulates in the tissues of the body. These types include amyloidosis, also known as primary amyloidosis. This type of amyloidosis is caused by the buildup of abnormal immunoglobulin light chains. It can affect multiple organs, including the heart, kidneys, liver, and nerves. Amyloidosis, also known as secondary amyloidosis. This type of amyloidosis is caused by the buildup of a protein called serum amyloid A. It is usually associated with chronic inflammatory diseases, such as rheumatoid arthritis and Crohn's disease. Familial amyloidosis. This type of amyloidosis is caused by genetic mutations that affect the production of certain proteins, such as transthyretin or apolipoprotein A1. Familial amyloidosis can affect the heart, nerves, and other organs. Dialysis-related amyloidosis. This type of amyloidosis is caused by the buildup of beta-2 microglobulin, a protein that is normally filtered out of the blood by the kidneys. It can affect patients who have been on dialysis for many years. Senile systemic amyloidosis. This type of amyloidosis is caused by the buildup of a protein called transthyretin, which is more common in older individuals. It can affect the heart, as well as other organs. What are the symptoms of this condition? Shortness of breath. This is one of the most common symptoms of cardiac amyloidosis. The buildup of amyloid proteins in the heart can cause the heart walls to thicken and become stiff, making it difficult for the heart to pump blood efficiently. This can lead to shortness of breath, particularly during physical activity or when lying down. Fatigue. People with cardiac amyloidosis may feel excessively tired or fatigued, even after getting enough rest. This can be due to the heart's reduced ability to pump blood, which can cause a lack of oxygen and nutrients to reach the body's tissues. Irregular heartbeat. The buildup of amyloid proteins in the heart can interfere with the heart's electrical system, leading to an irregular heartbeat. This can cause palpitations, dizziness, and fainting spells. Swelling. The reduced ability of the heart to pump blood efficiently can cause fluid to build up in the legs, ankles, and feet, leading to swelling. Weakness. The accumulation of amyloid proteins can weaken the heart muscle, leading to a decreased ability to carry out physical activities. Weight loss. People with cardiac amyloidosis may experience unintentional weight loss due to the disease's impact on the body's metabolism. Numbness and tingling. In some cases, the buildup of amyloid proteins in the nerves can cause numbness and tingling in the extremities, particularly in the hands and feet. What causes cardiac amyloidosis? There are several different types of amyloidosis, each of which is caused by a different protein. The most common type of cardiac amyloidosis is caused by the buildup of abnormal immunoglobulin light chains, which is known as amyloidosis or primary amyloidosis. This type of amyloidosis is often associated with plasma cell disorders such as multiple myeloma. Other types of amyloidosis that can cause cardiac amyloidosis include amyloidosis or secondary amyloidosis, which is caused by the buildup of a protein called serum amyloid A and is usually associated with chronic inflammatory diseases. Hereditary or familial amyloidosis, which is caused by mutations in certain genes that affect the production of proteins such as transthyretin or apolipoprotein A1. Dialysis-related amyloidosis, which is caused by the buildup of beta-2 microglobulin, a protein that is normally filtered out of the blood by the kidneys but can accumulate in people who have been on dialysis for a long time. Senile systemic amyloidosis, which is caused by the buildup of a protein called transthyretin and is more common in older adults. Overall, the exact cause of cardiac amyloidosis depends on the specific type of amyloidosis. It is important to work with a healthcare provider to determine the underlying cause of the condition and develop an appropriate treatment plan. What tests will be done to diagnose this condition? Diagnosing cardiac amyloidosis can be challenging because the symptoms can be similar to those of other heart conditions. However, there are several tests that can be used to diagnose the condition, including blood tests. Blood tests can be used to measure levels of abnormal proteins in the blood, such as immunoglobulin light chains, which are associated with AL amyloidosis. Biopsy. A biopsy of the affected tissue, such as the heart or other organs, can be used to confirm the presence of amyloid deposits. Imaging tests. Imaging tests such as echocardiography, cardiac MRI, or nuclear imaging can be used to detect changes in the structure and function of the heart that are associated with cardiac amyloidosis. Electrocardiogram (ECG) and ECG can detect abnormal electrical activity in the heart, which may be a sign of cardiac amyloidosis. Genetic testing. Genetic testing can be used to identify mutations in genes associated with hereditary forms of amyloidosis. Other tests. Additional tests may be performed to rule out other conditions that may cause similar symptoms, such as heart disease or other forms of amyloidosis. Is there a cure or treatment for amyloidosis? Most forms of cardiac amyloidosis are treatable, but curing this condition isn't always possible. The treatment also varies depending on the type of amyloidosis. In general, early detection is extremely important. Catching amyloidosis early can help long-term limit heart damage. Without early detection and treatment, permanent damage is possible. The only way to fix permanent heart damage is a heart transplant. Medications. Medications may be used to reduce the production of abnormal proteins, to help stabilize the structure of the proteins, or to manage symptoms such as heart failure, arrhythmias, or neuropathy. Stem cell transplant. Stem cell transplant may be used in certain cases of AL amyloidosis to replace abnormal plasma cells with healthy ones. Chemotherapy. Chemotherapy may be used in AL amyloidosis to target abnormal plasma cells that are producing the abnormal proteins. Liver transplant. Liver transplant may be considered in cases of hereditary forms of amyloidosis where the abnormal protein is produced by the liver. Supportive care. Supportive care measures may include managing symptoms such as heart failure, arrhythmias, or neuropathy, as well as ensuring proper nutrition and hydration. Clinical trials. Clinical trials may be available for new treatments or therapies for cardiac amyloidosis. Thank you for tuning in. We hope that it was informative and helpful. If you found it informative, please consider subscribing to our channel and leaving a comment to let us know what other topics you'd like to see us cover in the future.